I was here discussing the treatment and implications of acute relapses in relapsing MS. In terms of treatment, in terms of what relapse signifies, and in terms of the role of the treatment and recognition of relapse by the multidisciplinary team. A relapse is the sudden occurrence or worsening of pre-existing neurological symptoms. If they're pre-existing neurological symptoms, they have to have worsened and been preceded by a period of 30 days of stability. You have to have a thorough assessment and rely on patient self-surveillance and listen carefully to the patient about when it occurs, accompanying symptoms, what was going on with them at that time. The team approach is very important for an acute relapse because it signifies an end of stability, and there can be rehabilitation needs, needs of the neurologist for treatment of the relapse, or perhaps changing the therapy that they were using to control the relapses. And if there's functional changes, there is a need for the role of the rehab team in helping them regain that lost function. The ideal team is definitely, I believe, a nurse on the front line to help the patient with relapse recognition. Often it is the nurse or nurse practitioner that gets the call from the patient, identifying some of this change in symptoms and perhaps a potential relapse. Then it is often the neurologist or the nurse practitioner in practice that does a thorough neurological assessment, ascertains that this is a true relapse as opposed to a pseudo-relapse. And then if there's functional change or psychosocial impact, it is perhaps the social worker if it's psychosocial issues that have resulted from the relapse, or it's the rehab team, the OT, the PT, that helps the patient either adapt to a new function or improve the function they've lost. A pseudo-relapse is a changing pre-existing neurological symptoms that have worsened, but not because of new disease activity, but because of an underlying infection or increased stress or fatigue or exposure to extreme heat or aggressive physical activity that can sometimes mimic an acute relapse. Not always. They often are quite anxious about changing symptoms, and if they don't know, it's often the nurse who teaches them the recognition of a relapse, and then they get quite expert at it. They know what's a real relapse, or maybe perhaps if they have an underlying infection like a respiratory tract infection or a urinary tract infection. A lot of anxiety. Because they've been used to a period of stability and they're feeling well and they're doing well. And a relapse signifies either their disease is active because they're not on the right treatment, or they're relapsing because they thought that perhaps they didn't need a treatment and their choice was not to have treatment, and now their disease is not stable. So it is a marker for a patient of things not going as well as they should. We have to teach the patient that this is a new baseline and we have to be proactive, and so whatever is available to us, we want to treat the relapse, and then we want to help the patient get back into control of their disease. It may mean that they have to change therapies, perhaps they're not adhering to the therapy they're on, and it also means that they may have to do some rehabilitation with their rehab experts. But if you instill hope and wellness and getting back on track and support the patients, they do quite well. I think MS is a very unique chronic neurological illness in that it affects young adults in their prime of their life. So when things happen in MS, like an acute relapse, we're dealing with individuals who are working full-time, raising young children, working very hard, raising those young kids, taking them back and forth to activities, and so it's very impactful when things like this happen. So we want to be able to get them back to their previous level of productivity in life so that they can enjoy that quality of life that they should be having at that stage of life.